Hi everybody, it's Christina and Cindy, and we are on episode 3, I believe, of Rollin with Ruby, where we are just making some videos of our chats that we have on the road when we're traveling in Southern Illinois. Today, so Cindy, you tell us you've had the majority of your career has been in home health, right?
Yes.
Yeah. So tell us a little bit about your career in home health.
So I've been in home health for about the majority of my career, which has been about 30 years.
Mm-hmm.
And you see a lot of different things. You see, home health is usually ordered once people go to the hospital or they're being discharged from the hospital.
Yeah.
But with some of the stuff that we do with delivering equipment, oftentimes we see people that probably should have had therapy ordered but didn't.
Right.
So I think that's what we're going to talk a little bit about today, as far as recognizing those times that maybe when there's been what we call a change in condition.
Right.
So mom was able to get out of her comfy chair. Now she's struggling, taking multiple times to get up. Maybe all of a sudden dad is starting to what we call furniture cruise, which is holding to different pieces of furniture, maybe holding to the walls while he's walking in the house when he wasn't doing that before.
Mm-hmm.
Maybe there's been a recent fall.
Yeah.
All of those things are a change in condition.
And would warrant
at least an assessment.
Right.
Yes.
Right. So I did a short stint in home health in my career. The majority of my career has been in long-term care, but I did do a few years in home health. I thought it was very, very helpful.
Right.
With keeping my skills sharp like that, because you're on their turf, right?
Right.
In long-term care, people come into your nursing facility and they're on kind of your turf, and it is what it is. And so when you're in home health, I think as a clinician, it's helpful to see what kind of environment they live in, and as far as like the house, the setup, where the bathroom is, where the bedroom is, what do the pathways look like, all those things that we talk about for safety. So I think that's very helpful to know, to get to be a part of, to see, especially when you're writing goals for these people, to your home health patients, to rehabilitate at home. So anyway, though I agree with you that the being in somebody's home and seeing the change in condition, you need to know what is a change in condition, what qualifies for that, and then to be able to ask your primary care doc for that. So tell somebody, Cindy, what would somebody do, a caregiver do, a family caregiver do, if they saw their loved one or their client, if they feel like they had a change in condition, who would they tell next?
I think that they probably ought to contact the primary care doctor, and most likely they will have to see the individual. But if there's something that they were doing that they're not doing, again, that might warrant an assessment from whether it's physical therapy, occupational therapy, or speech therapy, depending on what the change is.
Yeah.
As far as physical therapy, if, like I had mentioned, maybe they're struggling getting up and down now. Maybe they've had a fall. Maybe they're unsteady on their feet. They're having trouble getting in and out of bed, things like that.
Yeah. For occupational therapy, it might be something as far as, activities of daily living. Maybe they were able to do self-grooming, and now they're really struggling with it, something along those lines, bathing, toileting, anything like that, dressing, feeding themselves. And then as far as speech therapy is concerned, maybe you've noticed a change in their language, in the way they use their language, not so much the speech patterns, but maybe the way they use their language, the way they understand. Maybe they're not understanding you as well as they used to. Those are all considered changes of condition, and you can contact their primary care physician. If you are a home health aide and you're seeing these, what would somebody do for that, Cindy, as far as contacting about letting somebody know.
Well, I think
Change of condition.
you ought to talk to the family and kind of let them know what you're seeing. Usually, I have the family initiate that contact with the doctor.
Okay.
But yeah, definitely talk to the family. You certainly can talk to a supervisor of yours if there's concern as well.
Yeah. So it's really about advocating for the client or for your loved one.
Right.
If you're seeing that changing condition, because I've had, as far as speech therapy is concerned, I've had families come to me and say, I've noticed this, or I've noticed that, or I myself as the clinician have noticed something, and wanted to get in there and maybe do some kind of a treatment plan for them. And I've reached out to the primary care physician, and they didn't want to have speech therapy, and I mean that's their call. So at that point, then I feel like it's important for me to talk to the family and say, here's what I'm seeing. If you're concerned, then maybe you need to reach out to the primary care physician. And I always talk to the family about, I'll reach out to the primary care, you reach out to the primary care, and we'll kind of tag team this whole situation, because more than likely it could be that the family caregiver is the one that needs to be saying something to the primary care before they'll do something about it. You need to be advocating for your loved one before the primary care will write a script, because we can't, as therapists, we can't just go in and start, doing a treatment or anything like that. We have to have a script. It's like anything else, like like a wheelchair or a lift chair, any kind of durable medical equipment. You have to get a script from the doctor, right?
Right.
So I think it's important to advocate for your loved ones. So
right. And Christina, as far as speech therapy as well, not just speech, but other things to look for.
Swallowing. Yeah, if you notice that your loved one is coughing or choking during meals, and there's a difference between coughing and choking, and that might be something we need to have some kind of put behind a members only video for. And so because there's a difference between coughing and choking. But at any rate, if you notice a change, that you notice them starting to cough more, runny nose, watery eyes, if you're seeing that while they're during a meal, that's probably a good indication that you need to go to the primary care physician and ask for a speech language evaluation. Again with the wording. Because there's so much more to speech therapy than just, and that could be a whole video on its own. There's so much more to speech therapy than just
talking
language, understanding what people are saying to you versus being able to make yourself understood. And I know it's the same way for occupational therapy too. With occupational therapy, when you go in and you introduce yourself as an occupational therapist, they're like, oh honey, I haven't worked in years, I don't need occupational therapy. But occupational therapy is about the occupation of living your day-to-day life. So physical therapy pretty much says it all.
Yeah.
Doesn't it, Cindy?
Well, I don't know. Sometimes.
Yeah. I mean, I know you still have to explain to people. I mean, because what do you get when you tell people that you're physical therapy?
They say physical torture.
Physical torture, yeah. Or they think you're a massage therapist.
Well, yeah, that's true.
I mean, that's a specialty in its own, too, you know? So physical therapy, people are like, oh, okay, I got this muscle.
Yeah.
And so you get, some people think that you're there to give them a good rub down, right?
That's right.
Yeah.
That's right.
So each discipline has their own battle with trying to get their message out of what their discipline does. So anyway, so anything else, Cindy, we want to talk about as far as home health is concerned? So just make sure you're advocating for your patients. Your clients, your loved ones.
A lot of things too with home health. It's usually again ordered when someone comes out of the hospital.
Yeah.
So one thing I would say as a home health clinician, you see a lot of is before your loved one is discharged, you really need to ask questions because there is a significant change in care. They've had skilled care, now they're coming home, now that falls on the caregiver. So, a lot of times the caregivers aren't necessarily informed as to what exactly needs to go on when
Yeah.
they get home.
Yeah.
So, you need to kind of continue, unfortunately, to advocate for your loved one. Make sure that they're having home health ordered. Make sure that is happening. Sometimes that gets delayed, so a lot of times that the initial few days or a week or so, care falls on the caregiver. So ask questions before you leave, like, what type of activity can they do, especially from the therapist.
Mm-hmm.
We don't want them just going home and then sitting.
Right.
As caregivers, we want to take care of them and we want to do everything, but if they were up, walking 200 or 300 feet in the hospital with their walker,
Yeah.
and they go home and sit for 2 weeks, then they're going to show a decline.
Absolutely.
So we want them continuing to do that same type of activity and doing for themselves what they can when they get home, as long as it's safe. So that's why you've got to ask lots of questions.
Yeah, and make sure that you're, do you need home health? We want to make sure that transition from the healthcare facility, whether it's a hospital or a nursing home, that transition home is going to be successful.
Right.
Hospitals don't want to send their patients home if they're just going, if they're just going to have to come back within 30 days. They're not really crazy about that. Hospitals aren't really crazy about that, and nobody wants to. Everybody wants to leave the hospital. Nobody wants to come back if they can avoid it. Right. So.
Right.
If there's something by calling in a home health, the skilled care or home health aide can help make that transition successful. Make sure that you're doing that. And again, like Cindy said, ask questions. What are my options as a family caregiver for home health? What kind of options do I have?
Right. And let's not forget, too, we do, just as information, we do offer a video subscription for caregivers. We have over 200 videos in our subscription, and it just basically shows the physical aspect of caregiving, how to get mom and dad up from the toilet or out of the bed or into the shower, things like that.
Yeah, we also have in that subscription, we also have the home safety toolkit as well, so you can get prepared if you're a family caregiver. Get that series and go through the house before you bring your loved one home, and check the home for concerns that you may have. Then take your concerns to the therapy department at the facility where you're at and say, hey, these are my concerns, and I feel like I need you to help me set this up for a good transition home, because all that's going to fall on you as the family caregiver. So
Right.
So if you go to AECorner.com, we have several different subscription plans. You can check those out. We got one for the family caregiver, one for the senior caregiver, and then we've got one for the professional caregiver, which are the home, like the occupational therapy, physical therapy, speech therapy, nursing, home health aid, that you can go there and just have an extra tool in your toolkit to be able to help your clients at home and help them stay age in place as long as possible.
Right.
So.
And don't forget, if you are part of the Corner Crew, the membership on YouTube, you get 50% discount on that subscription.
That's
you can do that by going to our YouTube channel, Adaptive Equipment Corner, and hitting that join button. We'd love to have you in our community.
Be a part of the Corner Crew.
Yes, we'd love to have you part of that.
Yeah. All right. Well, that's all we had today for Rolling with Ruby episode Trace. So everybody have a good day. It's a beautiful day here in Southern Illinois. The roads seem a little bumpy today, Cindy. Is it me?
They're super duper bumpy today. I don't know what's happening.
All right. So everybody have a good day. Take care of each other.